Dr. Bevilacqua, wow, what a great patient forum tonight. You must have been very pleased with how everything went.
Yeah, thank you. And I always love doing these events. The turnout tonight was great. So we had so many people coming here eager to learn about their disease and learn about what resources are out there. So just in general, I love doing these events. This was a particularly great one. The turnout was phenomenal. We've never had this many people come out. People were engaged. Yeah, always a pleasure to do these kind of events. I spend too much time as doctors and healthcare providers. Sometimes we talk to each other a lot, but we don't talk to the patients we serve. And so events like this, I think, are just absolutely critical that we get out there and do a little more of.
So why are things like this, a patient forum, so important to PKD patients?
I think there's a couple of things. So I think learning about the disease itself and having a better understanding of what it means to have PKD, how you can live well with PKD, what the treatment options are. I think just that education piece is a part of the value here. But I think the other part is just connecting patients with one another. I think when we have a group of people in a room and we're talking about something like this, it really takes away the feeling that they're the only one suffering there. They can look around them and see that there's people just like them from all walks of life also going through a similar experience, and knowing that there's that support and all those other people out there, I think is very helpful for people to know.
The second time that we've caught up with you at a PKD clinic, we were at the opening, which was quite exciting, last year at the PKD clinic opening in Surrey, and it was the first one.
Yeah, so, and this is an exciting time for us as well. So as you know, we've been here all day doing meetings and events and things like that with our kidney care team. And although at the time we were saying that this was the first one, it's definitely no longer the only place. And since then, we've had a few other areas in Vancouver have put together some dedicated PKD clinics or resources. They're doing that at Vancouver General and at St. Paul's. And more importantly, in BC, across the province, we're moving to try to have this as part of our kidney care clinics everywhere. So I think we've matured past the point of this being a thing that's delivered in a few individual clinics to now what our provincial kidney care group is doing is trying to find ways and come up with resources to put this in every kidney clinic across BC. So with the model of rather than somebody having to go see a special physician or a special clinic in a special place, these tools and all the same excellent care can be delivered close to home where they usually get their care. And that's where I think the future really is having a network of these across the province, all with the task and with the goal of giving the best possible care to patients where they live.
Things have come a long way, really, in a short period of time. What a difference a year makes, really.
Absolutely, and this is not just me. I would be lying through my teeth if I came up here and took all the credit for it. There is a whole group and team of people who are behind this. There's everyone in the BC Renal Agency and specifically our kidney care group who has done a lot of the on-the-ground work of trying to get this into every clinic. And there's the frontline staff who are engaged in this process and who are going to be the ones doing it. And there's the patients themselves, the patients and the patient groups like the PKD Foundation who have definitely let us know that there's a need for this, there's an appetite for this, to have this across BC. So I stand on the shoulders of a lot of different people who put a lot of work into making this happen.
What does it mean to you to have that one-on-one FaceTime with the patients here in a forum setting?
I find I sometimes see my own patients in these at these patient forums, and I sometimes learn more about them at these events than I do when I'm seeing them in the clinic and have been seeing them for some time. Because where people open up and share parts of their journey that maybe you didn't know about or never came out in a clinic setting. So this is why I think it's so important for us as healthcare providers to be doing things like this, to engage with our patients in a way that's a little closer to home and a little out of the clinical or hospital realm, because that's where I think the conversations tend to be different and we learn different things about each other. They learn from us and we learn from them.
Well put, and congratulations on a wonderful patient forum this evening, and all the best, and we'll catch up with you next time.
Absolutely. Thanks a lot, Barb. Always a pleasure.